What can you do while you're still young to help prevent any kind of pelvic floor issues, whether it be urinary leakage, bowel leakage, or pelvic organ prolapse? This is a question I get all the time from my young patients, from friends, family, pretty much anybody who knows what I do for a living. Maybe they're thinking about pregnancy or currently pregnant or just had a baby and they're starting to see symptoms of urinary leakage here and there, maybe a little bit of anatomical changes, maybe some perineal laxity. So, they're concerned because they know that their mom had urinary leakage or maybe their grandmother had pelvic organ prolapse and they really want to avoid developing these things, right? I think it's amazing that patients are trying to be proactive because I really do think prevention is the best way to address any kind of healthcare issues, right? So today I'm going to talk about 5 things that you can do now to help improve your pelvic health and hopefully avoid developing pelvic floor issues in the future. Number 1, avoid chronic constipation. So if you're somebody who is straining all the time to have a bowel movement or are not regular, make sure you're taking your fibers adequately. The recommendations are to do 25 to 30 grams of fibers every day. And I usually advise my patients to take the fibers with a lot of water because otherwise fibers can have the opposite effect, meaning they can make you even more constipated. Doing your fruits and vegetables. And if you have tried some of these dietary changes and you're still constipated, make sure to see a GI specialist to address any underlying issues. If you're somebody who is 45 and above, also make sure that you're up to date on your colonoscopy to rule out any colonic pathology. The reason to avoid chronic constipation is because it puts a lot of pressure on your pelvic floor muscles and your pelvic floor support structures. And over time, those pelvic floor support structures get weak. And as a result, women can develop things like urinary incontinence, pelvic organ prolapse, and all sorts of pelvic floor issues. Number 2, avoid chronic cough. So if you're an asthmatic or you have allergies or you have any kind of COPD or emphysema where you're coughing all the time, so just like constipation, that chronic cough can put a lot of pressure on your pelvic floor muscles and hence cause problems for your pelvic floor issues in the future. Number 3, weight loss. Yes, obesity is a big risk factor for all pelvic floor issues, whether it be urinary leakage, bowel leakage, pelvic organ prolapse, and there are lots of good data that shows that reducing your weight, even as low as 8% of your current body weight, just with exercises and healthy diet and healthy behavior choices, you can significantly improve things like urinary incontinence. I talk about this all the time to my patients that losing weight, whether it be through medication, surgery, or even just behavioral changes, can help prevent worsening of their pelvic floor issues or developing them in the future. Number 4, stop smoking. If I could only show you what smoking does to the tissue quality, as a surgeon, I see this all the time. It can really affect the connective tissue and can really affect the strength of the pelvic floor. Smoking can affect pretty much any organs in your body. So if you can cut down on smoking, that can be a huge help. Trust me, I understand how difficult it is for some of my patients to stop smoking because for a lot of patients, it's a way to manage their anxiety. But, even when I'm scheduling somebody for surgery, if they can stop smoking for even 6 weeks before their surgery, that can also help improve some of their symptoms. And finally, number 5, Kegels. Yes, everybody's favorite. Do your Kegel exercises. Just like any other forms of exercises, Kegel exercises can help improve the strength of your pelvic floor muscles. And when your pelvic floor muscles are strong, they can support your pelvic organs much, much better and can help prevent future issues. The important thing to remember, though, is to do your pelvic floor exercises correctly. And a lot of the times, I think patients, even though they feel that they're doing their Kegels, they're not doing it right. And that's where, things can get tricky. So make sure, you're getting the right kind of help, you're getting the right kind of guidance. If you're not sure whether or not you're doing it right, talk to your OBGYN, have them give you a referral to a pelvic floor PT so that they can guide you and make sure that you're doing the exercises correctly.